Hello, our viewers. My name is Wale Oloyede, your regular social worker and addiction therapist. And today with me is.
Hi guys, I'm Nurse Kazim Olamide.
All right, Nurse Kazim Olamide, you are welcome to the program. I would like you to tell us a little about yourself.
Okay, so like I said earlier, my name is Kazim Olamide and I'm a registered nurse. My specialty is psychiatry. Currently, I work in substance and detoxification units.
All right, thank you, Nurse Kazim. I'm particularly happy because you have interest in addiction treatment. I know there are psychiatric nurses that are not interested in addiction treatment, and that is why you are a good fit for today's discussion. Yeah, you can laugh, you know. It's very rare to find nurses in addiction treatment. And like I said, that's why you're a good fit for today's discussion. And without wasting much of our time, there is a particular topic that I want us to look at. I know a lot of people struggle stopping their substance use, especially those that want to stop on their own. They don't think they need to go to rehab. So we are looking at the subject matter, withdrawal symptoms. So from your experience, and understanding working with clients, what is withdrawal symptom?
All right. So withdrawal symptoms, they are just the physical and the mental symptoms that you see in people, in patients, especially in those that are addicted. I mean, they are the signs that you will see in someone that wants to stop substance. So if you have this Kelechi in your area that abuses Colorado and tells you that he wants to stop, so there are some signs that you are expected to see in that person. So if you don't see those signs, believe me, that guy is just telling you he's going to stop. He's never going to stop. He's still taking it.
Interesting. So if there is anybody that has been, abusing substance, let's say, like you said, weed or maybe crack or even drinks, addicted to alcohol, and he decides to stop. So what you are saying now is that it's not going to be an easy road for such an individual to just stop like that.
Never.
So if anybody has said is interested in stopping, there are certain symptoms that we must see to know that this individual has actually, taken his last, dose of the substance. Okay, that's interesting. So I would like to know, how long does it take?
Okay.
This withdrawal symptom.
This withdrawal symptoms I'm talking about, it takes like 3 to 5 days in some people, but it depends on the withdrawals.
Okay.
If it's a physical withdrawal signs that you're seeing in that person, it takes 3 to 5 days. But if it is someone that already has some psychological and mental withdrawals, believe me, it could be much, like maybe 4 months. It can take a longer time.
Wow, that's a lot. So we are going into the next question. Now, you've already said what causes withdrawal is when somebody decides to stop.
Yes.
So now we want to know, what are these withdrawal symptoms? What are these signs that we can see? So if I have a neighbor that struggles with, probably alcohol now or smokes, and he says he wants to stop, maybe he doesn't even tell anybody, and he's undergoing or experiencing withdrawal symptoms, how do I know that this is what is happening, and so that I can, seek help for this individual?
Okay, for such person, you need to know the drug that person is taking.
Okay.
We have withdrawal symptoms for everybody, but there are some particular signs you will see in someone.
Okay.
Let me make it simple. It depends on the drug the person is taking, like I said earlier.
Okay.
So if you have someone that takes alcohol, the sign you will see in that person is different from someone that takes codeine.
Okay.
It's different from what you will see in someone that takes heroin.
Okay.
It's different from someone that takes crack.
Okay.
So the signs that you are going to see in everybody is very, very unique.
Okay, so let's just look at few general signs that we can see in them.
Okay, so
yes.
Okay, if we are talking about general signs, for people that takes alcohol, they will have this shakiness, they will have this tremor.
Okay.
That's why you will see some people in their early 40s, they are already shaking.
Okay.
It's not as if they are even having withdrawals. Some people, the level of the damage the alcohol has caused is making them have those signs.
Okay, that will be another discussion for another day.
All right,
we want to know the damage, but today let us just focus on
withdrawals.
the symptoms. Yes.
Okay, so you see
tremor.
Yeah, you see them. Okay. You see them have tremor. You see them have some shakiness. You see them. They complain of headache.
Okay.
They complain of body pain.
Okay.
You see them sweat a lot.
Okay, even when they are
in a cool environment, like in the bank, maybe probably in an area that have AC. You see them. They just start. They sweat profusely.
Okay.
You're wondering what's happening. What's wrong?
Okay.
So for some people too, you see them. They are very irritable. They have irritability. You will only say, hello, good morning, Mr. Kelechi. Yeah,
So
person is
like
up.
they'll be having mood swings.
Mood swings, very irritable. They can't sleep.
Wow.
All day and night, they won't sleep. They have insomnia.
I used to have a friend. He will be able to sleep, but he will not be able to sustain the sleep. He will be waking up intermittently. That also.
Okay, let me explain that part. That
Okay.
sleep now, the person is not sleeping due to the fatigue.
Okay.
The person is not sleeping a normal sleep. A normal person should sleep for 8 hours at night or 6 hours minimum at night, then 2 hours during the day. The person will not even sleep at all. They have insomnia. They will tell you, I can only sleep for 1 hour. And for someone that's even honest, it's something good.
Okay.
And all these signs, if they are sustained for a longer time, can make the person relapse back.
So because of these troubling experience of the withdrawal, this person may eventually go back to the substance. Okay, does it affect their appetite? Because I know, I've seen people that say, they're not able to eat, so that's why they went back to
They
smoke.
can't eat. Yes, they can't eat. They affect that. It makes them lose appetite. They lost appetite for food. They don't want to eat. They don't want to drink. And that's why you see some people that when they wake up in the morning, they have to take alcohol. They have to smoke before they can eat. Because it's the effect of that thing that will open their appetite.
Wow.
So the moment they decide they want to stop, they start having withdrawals. They will not eat. And when you see most of them after like few days, they lost weight. They lose
Because
because they've not been able to eat. So they need to take it.
Okay. At this point, I know you have a lot to tell us, but then we don't have the time, like I said. So another most important question that I want you to answer, but not today, is why people need to then manage the withdrawal symptoms. Since we know that, okay, if these symptoms are not properly managed, they are, from what you said now, they could be life-threatening. And then some people can easily just go back. You understand? So I would want to crave your indulgence to, come again so that our listeners at home, they will be able to know why it is important for us to, manage withdrawal symptom clinically, which is your work. So we look forward to, having you again on the program. I want to say a very big thank you for coming, Kazim. We really appreciate you. Thank you for the good work you are doing.
All right,
All right, bye everybody.